All right, hey Johnny, welcome back.
How you doing?
Very good, nice to see you again. So as you know, today we're going to go over your report of findings here. So I just want to, before we start going over it, I just want to say your report of findings is very important. This is all about your health, so if you have any questions at any time, please ask about it. So this is what we're basically, our plan to improve your health as we're going forward with your treatment. Okay? All right, so last time when you came in, we went over some of your initial complaints. The reason you came in to seek care, you had a skydiving accident.
Yes, I did.
All right. So you had some neck pain, you had some pain in your knee, and some low back pain. So how's all that going right now?
Yes. Painful.
Still there?
Yeah.
Like a dull pain, achy?
Dull, radiating. Yeah.
Okay. All right, so we're going to go over those. We're going to talk a little bit more about those three things as we go on. I also reviewed your case history. You've had past history of high blood pressure, and you've also had some headaches in the past. So since your accident, when you came in, have your headaches gotten worse? Have they gotten more frequent?
Definitely got worse, more throbbing.
More throbbing?
Yeah.
Okay, so the headaches are getting more painful and more frequent or less frequent?
More frequent as well.
Okay, and that kind of makes sense based on your traumatic injuries. All right, so we did a full physical examination on you when you were here last time on your first visit. We did some neurological examinations, and all those were normal, which is good, so we're not suspecting too much big nerve damage, which is really good. However, on the orthopedic test, with your knee, you had an instability of lateral meniscus on your right knee.
Okay.
So we're just going to go over that a little more. And then also with your physical, back to your high blood pressure issues, you were a little bit high there, 150 over 100 was your last visit. When you came in today and we took your vital signs, you were 130 over 95. So that's a little better. We're going to keep trying to improve that, and we'll go over that at the end with some of my recommendations for you. All right, so we'll go over some kinesiopathology stuff here. Let's see, we had high musculature on your C4 up in your neck area, which kind of makes sense there. And also some high musculature on your right side in L2. Going on there a little more, we did a leg check last time. Your right leg was a little long, so it's not a big issue. We could discuss that further. Do you have any questions so far?
No.
Pretty good so far? Okay. We went through your range of motion. We tested your cervical range of motion in your neck. There you had a decreased range of motion overall.
Okay.
Nothing really significant, but it's to be expected. The muscles are probably really tight in there, so we're going to work to loosen those up and get you full range of motion restored. Lumbar range of motion was also decreased slightly. And that could be it could be just a whole chain of events with your hip and your knee pain, low back pain, so that's also to be expected, nothing too crazy there. All right, so continuing on, we'll talk about some other subluxation degeneration issues. I'm just going to explain them to you really quick. There's 4 phases. Each phase gets a little increasing of damage, pretty much. So basically, you were at about a phase 2 is where I put you at for this. Phase 2 is a misalignment and malfunction with soft tissue degeneration and calcium salt deposits.
Okay.
So a 2 out of 4. So we're going to get you to basically full health. So we'll get you fully restored. And the way that we're going to do that basically is the wellness care program. So we can go over a little bit today, and most of it will be done in our wellness class that we offer. Okay. And Zach will talk a little more about that later. So that'll basically lay out a little bit more of your diet for you, help control your blood pressure, maybe some exercises for your knees, stuff like that. So my recommendation for you, pretty much, we're going to try to do 3 times a week. For the first month, and then after that we'll see where we're at, and then maybe you reduce it down to two times per week.
Sounds great.
So that's pretty much it for the report of findings. Do you have any questions about anything?
Not at all, doctor.
Okay, perfect. I'm going to bring in Zach to give you the office procedures. Okay, thanks.
Thank you, Dr. Ellis.
Hey, Mr. Lee.
How you
I'm
doing?
Zach. I'm Dr. Ellis's assistant. I just wanted to go over a couple of things with you, explaining our office policies and procedures, and just some of the protocols we do, kind of what to expect. I want you to know that initially, for any new patient, we offer a complimentary health screening, just as a free service. Just offering services such as like checking your blood pressure and cholesterol levels, stuff like that. Just to give the patient a general understanding of where they stand as a starting basis. That being said, the doctor's objective is basically to custom tailor their care plan so that the patient will achieve their intended goals and hopefully exceed them. For as far as their wellness is concerned. But basically, for that to happen, there are a few protocols that we have to do, a few rules. I guess first of all, anything that's discussed in the office regarding the patient is totally confidential, and we honor all and respect and abide by all the HIPAA laws passed in 1996 to cover patient confidentiality. So we abide by that. Dr. Ellis requires for each patient to do a kind of a health wellness kind of seminar thing that he gives. He offers it twice a month. He does it on the weekends, so and he's kind of flexible as far as setting up appointments for that. But basically, that's kind of a little bit more detailed version, explaining a lot about what chiropractic is and what it can do, to help you, along the way in your journey for better health.
Right.
So, just kind of let you know what to expect out of chiropractic and Dr. Ellis, and then in turn, kind of let us know what we expect out of his patients. So, there's some office hours I need to go over. We're open from 5 days a week, Monday, Wednesday, and Friday. We're open from 8 to 5. Tuesdays and Thursdays, 10 to 3.
How you doing? Johnny. I'm from Dr. Ellis's accounting department and billing. I'm here to discuss basically a few things about billing and accounting and insurance at Dr. Ellis's office. First of all, we welcome you as being a patient here, and based on your condition, Dr. Ellis is going to require you to come so many times, and based on your insurance is going to cover you up to 10 visits, 20 visits, or whatever it is. So after the insurance company covers the visits, the additional visits that you come is usually to come out of your pocket, and this is where we come in to offer you very flexible payment plans. So one of our payment plans is that you pay just per visit coming in, once, twice, whatever you need. Another payment plan we have offers paying a lump sum. So if you pay a lump sum up front now, we actually give you a 10% discount in our office. So that's a pretty good offer. Another one is just paying auto pay. If you really enjoy chiropractic and you want to be up to par with your health, definitely just be auto pay, and you could cancel that at any time.
Does it draft out of the bank or something?
Yeah, you would just talk to our billing department and we would set that up for you very easily. So,
That's convenient.
yeah. So, any other questions about our billing department?
No, I think that's got it. I
All right,
appreciate it.
thank you very much.